And thank you all for joining us today. I'm Nina Carlson, president of Clackamas County Business Alliance. We are really delighted to be able to host this program today and want to thank all of you for joining us here. We strive to bring relevant information to our folks and to have a good interface with our elected officials and some of our Clackamas County staff. So with that, we're excited to have Commissioner Sonia Fisher here today and Jill Smith, who is the Director of Housing and Housing Services, and Vahid Brown, who is the Housing Services Manager. And they're going to talk about the homeless services and housing bond from Metro and how that is going in Clackamas County. So with that, I'm going to turn it over to Commissioner Fisher to kick us off. And thank you again for joining us.
Thank you so much. I really appreciate the opportunity to be here today and talk with you about the supportive services measure. It has been quite the journey being part of this effort. So Jill, you might have to nod. I'm trying to think, it was a February, was it 2 years ago that I went with the delegation to Los Angeles to study their effort there, which was really a comprehensive look at what is called a housing first model, which means the evidence-based methodology of eliminating barriers to housing by providing wraparound services and getting people off the street, with a focus on providing support for those who are most challenged by being chronically homeless. Now, there's a lot of reasons why this effort was undertaken, and in my mind, one of the most critical policy points is that the people that are struggling with houselessness, especially those that are chronically homeless, are taking up far too much of our public safety and hospital resources. They're considered frequent users of the system, and it creates this tremendous imbalance in how we are able to deliver services in our community. So how this all got started, and the reason why I'm giving a few words today is because, quite frankly, it was a political effort from the beginning. And some of you may know, I think all of you might know, Ted Wheeler, Deborah Kafori, Mayor of Portland, Chair of Multnomah County Commission, who sought to address homelessness in the Portland region. And they asked Bob Stoll, who is a retired lawyer from Portland, to spearhead this effort. And what Bob Stoll found very quickly is that this is a regional effort. So he brought together Clackamas and Washington County and service providers, other business leaders, elected officials, and leaders from the communities of color and faith communities, and I will say a lot of community advocates that really created this massive coalition as we went through the process of gathering information and looking at how we could look to address this issue in the region. The important piece that I want to share with our business leaders is that the Portland Business Alliance was at the table for the entire effort that we proceeded once we were looking at a measure. And it was quite a learning, I'll put my cards on. It was a learning process for me. I really thought Portland Business Alliance, it's region-wide. There are members from around the state. It's very active. And I really, as a elected official who was just sort of weighing in on this, relied on their expertise and what they brought. Really critical to really focus on what the business community saw as the key issues. So some of you, the political piece of this is really fascinating. My interest at the table, of course, want to help affect homelessness, but also wanting to make sure that Clackamas County not be left behind, make sure we had a strong voice, make sure that we had an equal say at the table, make sure that we were able to have local control, making sure that we spearheaded our efforts, which are very much locally based and not driven by anyone else's agenda. So that was my place there. Jill Smith was on speed dial to me, helping me through every step of this, and Vahid also on speed dial, Rick Swift on speed dial, and also my Jim Bernard, former chair, was very involved in this effort as well. So what happened politically is the coalition wanted to put this measure on the ballot in November of 2020. They wanted Metro to put it on the ballot. My interest, of course, was looking at all of Clackamas County, but it was not politically feasible for it to be all of Clackamas County or all of Multnomah, Washington, and Clackamas County for this measure. It was politically feasible to pass this in the metro region. And so that's what the coalition, that's the method that they took and wanted it on the November 2020 ballot. And that was Metro, through the leadership of Chair Lynn Peterson, who wanted to speed up the process. If Metro was not going to put it on the ballot, the coalition of Here Together, they were ready to go get signatures and put it on the November ballot. So that's how that all happened. And through the negotiations and all of the intricacies that went into getting this on the ballot, I have to say that I was so thankful and appreciative to all of our partners and the Portland Business Alliance, especially in strategizing the funding mechanism, in strategizing the clause which this will need to be renewed in 10 years, and really prioritizing the interest that we needed to have adequate funding to address the problem. So with that sort of frame and political background, which I hope you found interesting, I want to pass it off to Jill and Vahid, who will give the nuts and bolts of what we're going to be talking about today.
Thank you so much, Commissioner Fisher, for that. It really does help to set the stage to understand all of the work. She just touched on a fraction of the work that went into the creation of the measure that then was just sort of handed over to Metro to refer to the voters. And another big part of that was negotiation around the distribution of the resources. Sonia, do you want to add? I know you have a unique perspective on that. Do you want to add a little bit to that?
Sure. This was a really important piece because when we are looking at a funding mechanism that focuses on higher earner income tax and a business income tax, which looks at businesses with revenues over $5 million, at the time, it was impossible to know exactly how that revenue would play out. So when we were sitting around the table, and it was actually Chair Harrington from Washington County, who has Nike, Intel, big corporate businesses, made the comment of, she said, it's not going to do us, and I don't mean to quote Chair Harrington, but I appreciated her comments. I will summarize, or that it won't do our region any good if Washington County has the bulk of the resources and leaves out other communities because we have the bulk of the wealth. So in that frame, the effort was to look at population, and the region had a framework for that because of the Metro Housing Bond, which looked at how those funds were going to be distributed. So this measure was modeled after that. But it definitely was a political discussion of how do we move forward and make sure that Clackamas County got its piece of the pie.
Thank you, Commissioner Fisher. I just think that your ability to provide context, those conversations that I was not always a part of, are really insightful. And they show us how much thought and preparation went into this. And the measure passed. And we have resources coming into Clackamas County that can only serve, unfortunately, you know, within the metro boundary. That is where the majority of the problem exists. But there is housing insecurity and homelessness outside of the boundary that we need to address, and we are intending to prioritize existing funding sources to do that work. So what can these funds be used for? First of all, we anticipate in year one, starting in July of this summer, having approximately 24 million coming to Clackamas County to program for. And it's very specific the way what we're authorized to use this funding for. The bulk, the majority of this will be used for supportive housing, and supportive housing helps the most vulnerable people who are disabled, who are extremely low income, and are homeless. That was a big point of discussion and contention in conversations I was a part of from the very beginning. To be honest with you, it's easier to show success if you help the folks that are easier to house, and that's not our intention. We want to invest in providing housing as well as the wraparound services that each individual and family needs to stay housed and to be successful and achieve, you know, their goals. Long-term rent assistance is a part of that. Most of these folks, they're disabled. They have a lot of challenges they're dealing with, and it's not anticipated that the bulk of the folks helped with this will be able to graduate off the program. These are high needs disabled people. 25% of this funding, and I'm going to get more into this in a minute, can be used to serve people that are a little bit less high needs and high barrier, that aren't necessarily disabled, but that are homeless or on the verge of homelessness. And for folks in that situation, short-term rent assistance, sometimes just an infusion of assistance to keep somebody stably housed while they're going through some sort of health challenge or their car broke down, something to solve a short-term problem, keep a family housed and stable is all that's needed. So there will be funding programmed for that population as well, albeit a smaller portion. Housing placement services and outreach are something that is essential when you're dealing with a homeless population that is living all over the county in places that you normally wouldn't be able to find folks. So housing outreach and placement is critical. Placement services also help us to build and coordinate with our local landlords. Landlords will be an essential part of this programming and an essential part of the solution. Eviction prevention for folks in place, like I said, keeping them stable. And then shelter and transitional shelter type services are something Clackamas County really has very, very limited amounts of. I think we have 3 or 4 very small family and domestic violence shelters in our county. There's no kind of shelter that's permanent for somebody that just doesn't fit into those specific categories. It's extremely limited. As we've done community engagement, that has risen to the top as an area that residents of Clackamas County want to see addressed with this funding. Prioritizing communities that are in need. This measure and the language associated with it requires that as we plan for the use of this funding and as we report out our success in utilizing it in housing people, we have to report how we've been successful in prioritizing communities of color who are disproportionately impacted by homelessness. We have lots of data on that. If people are interested, we'd be happy to provide that. As I said, people with disabilities experiencing or at risk of prolonged homelessness who are extremely low income are the whole target population for 75% of this funding. with racial equity leading that investment. And I just wanted you to know what it means to be extremely low income. We toss that term around a lot, but we often don't talk about what that means. And so I hurried and printed out what that means. For a family of one, so if you're a homeless, disabled person who's been homeless for a long time, yearly, you're earning less than $20,000 a year. And generally, those are people who get Social Security for a disability, and they earn around $700 a month, or they're seniors earning some sort of Social Security. I don't even think there's any rent out there for that much money, so that would be 100% of their income going to a unit that's rent amount doesn't exist. For a family, just to give you a little more perspective on income, for a family of 4, that would be earning less than $27,650 a year to support a family of 4. That's the extremely low income limits. And I have all of those as well. They're easy to Google and find. And then finally, people experiencing episodic homelessness or at risk of homelessness are that 25% of the folks that we will be helping. One other thing I want to share is, sorry, Vahid, is that we have been told that the good news is, as we invest 75% of this funding to help the highest need, and over time end chronic homelessness, which is our intention, we can then maintain, that housing for these highest need folks and focus more and more of this resource on the folks who just need those short-term infusions of assistance to remain stable. So we're anticipating this is a shifting opportunity, which will allow us to, to create this program as the community changes and the needs change. And I've touched on this already. This is a good diagram, though, that shows the 25% commitment to folks who are homeless or have a risk of homelessness, but the requirement for them to be disabled and have been experiencing long-term homelessness as well as extremely low income is not there. And now I'll turn over the rest of this to Vahid to talk about where we are on implementation.
Thank you, Jill. Yeah, so the this implementation timeline, you can kind of see we're in the second orange bubble on program implementation, as are the other 2 counties working on implementation plans. The measure, after it was passed by voters earlier this year, there was a stakeholder advisory group that was convened that included members of this presentation team to kind of determine some of the overarching values and principles to guide the advancing of racial equity and the implementation of this measure and other things. And once the stakeholder advisory group was able to meet, the work plan for the development of local implementation plans was sort of sent out to all of the counties. We embarked on that at a moment when we also were confronting other severe challenges in Clackamas County. Obviously, September was a difficult month for Clackamas County because of the wildfires. So this work has gone concurrent with many other emergent challenges that our staff have been addressing. But we are in that timeline, and as you see, January is the end period for the local development of implementation plans, local implementation plans. We are working with our local implementation plan steering committee, guided by extensive community engagement work, which I'll discuss in a moment, to develop that plan. And that is a high-level strategic document that will guide the investment priorities in the coming years and the first several years of implementation. As Jill said, investment priorities will be flexible and change as the measure implementation goes into future years, as we see changes in the need. And so that 25-75 that is our starting point for program implementation may shift as we're able to move more of the dollars into other needs and other less vulnerable populations as those populations' needs are met. So once the The local implementation plan is developed locally. It will go to our Board of County Commissioners, to the Metro Oversight Council, and to Metro Council. And the implementation of contracted services for the measure will begin in July. The measure also created a regional oversight committee, which includes membership from all 3 counties. And so that's a 15-member body with 5 members from Clackamas County who sit on that board. The oversight committee, the regional oversight committee's role in the coming months is to evaluate our local implementation plans, make comment upon those, and then refer them to Metro Council. And once those are confirmed and affirmed by Metro Council, we would enter into intergovernmental agreements with Metro to sort of begin to launch our local implementation plan. And then that regional oversight committee will continue in an ongoing way to track the metrics and outcomes established by the measure for housing placements, housing stability, and so forth, as well as our progress on advancing racial equity in the way that we're doing the program implementation. Revenue collection, the tax systems were established throughout the year, and in the beginning of this year, tax collection is beginning at the beginning of the year. Revenues will be collected in the spring, and as I said, in July 1, the beginning of that fiscal year, we will have dollars to fund services to house vulnerable folks. Excuse me. The local implementation plan that we are developing currently, as Jill and Commissioner Fisher noted, this measure really has an emphasis on leading with racial equity, and so there is a number of components of the plan that address that. Of course, overarching, there's a commitment to advancing racial equity, and the plan will include an assessment of barriers and of areas in which communities of color are disproportionately impacted by homelessness and housing insecurity within Clackamas County. And as Jill mentioned, we have done a lot of research on that and have data demonstrating which communities within our county are disproportionately impacted by homelessness. The local needs analysis and local program priorities are also developed from analysis of data from our homeless management information systems and from our current programs, as well as from the engagement work with lots of different community groups and bodies throughout the county to determine what the community at large sees as the overarching needs, gaps, and barriers with current funding and current programming. And of course, it's a regional measure, so it's our plan will include commitments to ongoing regional coordination with the other 2 counties and with Metro in implementation and with monitoring of metrics. And we are currently coordinating with the other 2 counties on a regular basis as we work through our implementation plan development. With respect to the commitment to racial equity as well, the county hired 2 consultant agencies, the Unite Oregon and the Coalition of Communities of Color, to convene focus groups of communities of color, immigrant and refugee communities, folks in our county for whom English is not a primary language, to really dig deep into what the needs were, what the services that were missing or available to them, and how they access them, to inform our program priorities and where we see we need to address gaps in how we're able to deliver housing and homeless services to communities of color in the county. So the engagement that was conducted through the course of the development of the plan, as I mentioned, it included a lot of community groups. I think it was 17 groups, including a lot of the advisory boards and committees that are appointed by the Board of County Commissioners to advise the work of various county departments and divisions, including like the county health services, the public health department, the emergency medical teams, law enforcement. So it was across a lot of different areas of community groups and advisory bodies to sort of gather information on 3 broad questions, really, that we were seeking to get insight on from the community. One, what are the gaps? What are the main gaps in the homeless services system as it exists today in Clackamas County? What are the primary barriers for communities of color in accessing homeless services and in addressing housing insecurity in Clackamas County? And then what would be the funding priorities that you, advisory body of the Public Health Advisory Council or what have you would identify as priorities for this funding in year 1 or year 1 to 3 as we move into implementation. So these next 3 slides are kind of report back about what we heard from the community with respect to these 3 questions. So when we asked the community largely, oh, and I also mentioned we also had a couple of public engagement sessions with the public at large, as well as a survey that was widely distributed through the county and from just general members of the public to respond to these broad questions. So the question of what's missing, what are the main gaps in homeless services in Clackamas County? This list is the top of there were more. There were lots of gaps identified and things that people noted that were needed in the community to assist very vulnerable members of our community. But these were the top 6 that came from our engagement. A lack of effective behavioral health services, and that includes addiction and recovery supports for people with a substance use disorder. A lack of shelter, transitional housing. As Jill mentioned, there's a kind of a dearth of these resources in Clackamas County, and so this was identified as a main theme. Rental assistance, gaps in the availability of rental assistance funding. Outreach, so this was also identified as a gap, and Jill touched on this a little bit. There are people experiencing housing insecurity and homelessness all throughout the county. As I said, some of them may not speak English, and our capacity to reach everyone in the community who is in need of assistance is limited and needs to be augmented according to this engagement. And there's barriers in terms of the eligibility and qualification requirements for accessing services, and system navigation issues. So the lack of supportive housing, the lack of the ability to navigate a complicated system of accessing services, and kind of basic life skill development programming. These are the themes that emerged when we asked the community, what's missing now? When we said, what are the main barriers for communities of color? These rose to the top in that engagement. And these are consistent with the engagement that was conducted by Unite Oregon and the Coalition of Communities of Color, as well with focus groups, as I mentioned. A lack of culturally specific and appropriate services and information. So that was the #1 barrier for communities of color when we surveyed on this question. A broad mistrust of government, and this was coming a lot from input relating to immigrant and refugee communities, and fear of accessing services, safety net services, because of ways that might imperil their immigration status or their ability to remain in the community. And so that was a theme that emerged as a lot with engagement with that community. Disproportionate issues with rental screening barriers, meaning that there were our service providers and our advisory groups were seeing disproportionate barriers with respect to these things for communities of color specifically. So people of color in the community are finding this barrier impacting them at greater rates and with greater impact than other members of the community. And again, a system navigation, kind of barriers in accessing services. So ways that the county can reach these communities, the existing network and systems for accessing services were determined as themselves a barrier. They're not adequate to reach these communities currently. When we said what should be the priorities for funding, it was slightly different than the gaps. So when we asked folks what are the gaps and what's missing, the top 2 answers are still the top 2 answers. They're just inverted. So there's a slight change in that. So when we asked what should be the #1 priority as we move into program implementation, shelter and transitional shelter services were #1 by a significant margin. So we heard this over and over and over again. This was a critical need. In addition to that, again, it's behavioral health services. Low barrier mental health and addiction supportive services were identified as priorities. Again, system navigation, service navigation comes up again near the top. Supportive housing opportunities. And really we heard over and over from the community that there's just a lack of housing. This continues to be a challenge. This has been a challenge for many years. It's a difficult housing market for everyone, and people at the lower scales of income really struggle to find and maintain affordable housing. So that was identified. We heard that over and over. So those are the themes that we heard from our engagement. The next steps for us are to sort of have our final meetings with our local implementation plan steering committee, which has already been grappling with these engagement themes, and the input we've heard from the community has been looking at the data from our systems in terms of who are we serving, who is being missed, where are communities of color disproportionately appearing in our homeless services system, and identifying and putting forward strategies to address those gaps and to address racial equity and disparities in our systems, and to respond to this community input about funding priorities, to include those in the finalization of our plan, which is to be completed. A draft is to be completed in the month of January, and then we will move to engaging with the Board of County Commissioners on that draft. So we have.
Thank you so much for that presentation. That was really wonderful. Oh, Vahid, I'm sorry, I didn't mean to cut you off. With that, I'd like to go ahead and open that up to questions. Please direct your questions to the chat feature and the Q&A feature. While we're waiting for those to come in, I really want to thank the three of you and your teams for all the hard work you've done on this. It's really been, it's an exciting time to finally have some funding coming in. So we're hopeful that we can see some progress made. Just waiting a few more minutes. Okay, it looks like we have a question here. This is from Scott Davids. One of the benefits of nonprofit service providers that will deliver the services is their efficiency, low overhead, limited administrative staff, and money put to work the right way. With that in mind, what is the county's plan to reduce the compliance burden for nonprofit partners that deliver SHS services to help them with cash flow so services are rolled out quickly, and to reimburse nonprofits for the overhead costs they do incur? Jill, please.
I would love the opportunity to address that question. This is something that is a priority for our work on this measure, is drawing more nonprofits and actually having a broad network of nonprofits that include culturally specific providers across Clackamas County. Unfortunately, right now, we have quite a few less than Multnomah and Washington County, and this is a great opportunity to change that. And we feel strongly that we need the community to be our partners. And we know, after talking to communities of color and people that are homeless, that often working with government is a barrier, and we want to correct that. So we've also mentioned in this presentation that this is regional work. So we are actively working with Multnomah and Washington County in hopes that we can create a streamlined, barrier-reduced RFP type of process, along with a streamlined reporting process, so that if one provider, for example, is working across the region, we want to eliminate all those barriers for 3 contracts, 3 different reporting requirements. We're trying to streamline things. We have talked to nonprofit providers that work in our county as well as across the region. We've listened to them. We're aware of the burdens we've placed on you all, and we have a strong desire to reduce those. This funding lets us do that. This funding doesn't come with all kinds of federal or state requirements. So this is an opportunity to get it right. Additionally, we have heard you related to administrative fees. Metro is in the process of working with their council right now on an intergovernmental agreement that will define what we're allowed to pay in administrative costs, but we are at that table and we're making sure that your needs are heard, and we're also working to ensure that we correctly define what qualifies as an administrative cost and what doesn't, what should be included in operations, so it doesn't have to count towards that threshold. So I just want to assure you that we've heard you and we're really actively engaged in making this work.
That's fantastic to hear. Thank you. With that, we don't have any more. Oh, here we go. Another question just in time. I've got from Bridget Brooks. Thank you for your work on this. I am part of the Washington County LIP committee. I'm also a city councilor in Tualatin. How do we address the overlaps in county needs, assessments, and supports? I think this is also about service deserts like our city. Then we have a comment from Ruth Adkins. Thanks so much to the commissioners and Jill Vahid for your outstanding work. Kaiser Permanente was honored to support this measure, and we are thrilled to see the historic work move forward to address the needs of our community. Can you talk a bit more about the private sector, including healthcare, how the private sector can partner, and your support efforts, which I'm similar to what we just covered. I think Ruth and Scott are on the same page. And then we have another comment from Councilor Kathy. I don't, Hizzy. Thanks for the great presentation all. It's great to see this effort unfolding. 2 questions. As someone in city government who is concerned about the immediate need for shelter this winter, do you have any advice for how we can be supportive partners to the county right now? And more broadly, how can local government be the most effective partner in the Here Together effort over the next few years?
Zahid, I was hoping you could take the first question. I'm having a hard time seeing all of them now.
The last one is on the Q&A section at the bottom of your screen. It's just Councilor Kathy right now. So the question was, to reiterate, as someone in city government who is concerned about the immediate need for shelter this winter, do you have any advice for how we can be supportive partners to the county right now?
Yeah, that's a great question, Counselor. I think the Health, Housing, and Human Services, Social Services, and the Emergency Operations Center have been working together this winter to meet the needs for winter shelter, attempting to sort of adjust to the very complicated public health context that we live in with COVID, and kind of identify and lease or rent as many motel rooms as possible for people experiencing homelessness to shelter through the winter with supportive services attached to that. And I don't have a concrete answer for how the cities could support in that effort in the moment, but I think that the Director of Social Services, Brenda Durbin, and the Emergency Operations Center in that work, if there are resources or ideas that cities or business leaders have in partnering with the county on that, I think that we would be welcome to hearing about it.
And the second part of her question was, more broadly, how can local government be the most effective partner in the Here Together effort over the next few years?
So I'm going to chime in on this one, and then Jill and Vahid, you might want to add to it. But I really appreciate our partners in our local governments who have been very much a part of my support network in bringing this forward and being in communication and strategy and really looking at what the needs are. Hearing from people who are representing their communities throughout our region is so incredibly helpful. So I think that the open dialogue, continuing to connect with us and us back with you is absolutely critical. And I know that in Milwaukee, there are tremendous needs. So just keep communicating with us. And you've had champions in, like, former Councilor Wilda Parks was heavily involved with so much of our planning in Clackamas County. So continuing that dialogue is very important, and it's very appreciated too.
Helping us to cite affordable housing and shelters in cities. whatever influence community members and leaders can have with that, that really is at the core of this work. We need, as Vahid stated, we need housing and shelter for folks. And then while I'm speaking, I wanted to address the question from Bridget. She's a part of Washington County Local Implementation Plan Committee and a city councilor in Tualatin. And I really appreciate this question. It says, how do we address overlaps in county needs assessments and supports? I think also about service deserts like our city. I live in Tigard, right next to Tualatin, and I know there's a lot of service deserts in Washington County and many in Clackamas County. And this measure requires all of the jurisdictions, the 3 counties, to set aside 5% of their funding, which we will work together as a regional body to build a system. Homelessness doesn't know boundaries. People, regardless of where you live, what neighborhood you're from, there are people with challenges that need help. And so we are working together, and we meet every week, leaders from all 3 counties and from all 3 housing authorities. And we have a commitment to create a system that fills in those gaps across the region in service of the people that need our help. So that's a big part of this work, and I appreciate that question.
Thank you. There's another question from Jane Morrison, and it is, how does your work interact with or contribute to the Clackamas County's land use housing strategies now in the planning stages?
So I'll take a go at that. Not as much as it should. I think that we're aware of that. And we know that our efforts need to align. Our first step towards greater alignment was we had a committee that was our, I'm trying to remember, the Affordable Housing and Homelessness Committee that met for about 1.5 years, and we studied these issues. It was before the measure passed. It was before we had this resource coming to us. And we had folks that are involved in zoning and land use at that table. And I have to admit, it made a huge difference. Because of that, they created, the Department of Transportation and Development created a work plan that included several zoning change considerations and changes in the way that they allow for things like an ADU that can really make a big difference in solving our unit issues. That was one step forward, but I think we need to do a lot more. And I appreciate you bringing that up. If you have ideas that would help us, happy to hear them.
Thank you. I'll give it another minute. I thought that has been all of the questions we have so far. Thank you so much for coming and being here today. It's been really wonderful to learn about all the hard work you've been doing, and hopefully 2021 will continue down follow through with some wonderful help and aid that is very much needed in our local communities. So with that, thank you so much for participating, for being here, for all the work that you're doing. We got an extra thank you in chat. Just thank you all, and I hope you all stay safe, and 2021 will hopefully be a bit brighter now that we're through the first 7 days. We'll see. Thank you all for joining us. Have a good month.